Hello and welcome back to EpiDecoded. I'm Dr. Arora, and in today's episode, we're exploring a critical, often overlooked aspect of epidemiology, the natural history of disease. It's a concept that quietly guides almost every decision in medicine and public health, from when to screen for cancer, to how aggressively to treat, to what we tell patients about what to expect next. We're going to talk about what happens when disease unfolds without intervention, how we describe prognosis, and why understanding what comes next can help shape what we do today. Let's begin with a simple idea. Every disease, whether it's a cold or cancer, follows a natural course. It has a beginning, a middle, and an end. In epidemiology, we call this the natural history of disease. It refers to the progression of a condition from its earliest detectable stage, all the way to its resolution, whether that's recovery, chronic illness, or unfortunately, death in the absence of treatment. Why is this important? Because if we understand that timeline, we can intervene earlier, act smarter, and improve outcomes. Now imagine a horizontal timeline, a disease moving from left to right. On the far left, we have the biological onset. This is when something starts to go wrong inside the body. Maybe a single mutated cell, maybe a virus beginning to replicate. At this stage, the person feels completely fine. There are no symptoms. Next comes the preclinical phase. The disease is present, but not yet causing signs or symptoms. This is the window of opportunity for screening. If we can catch a disease here, think of a mammogram detecting early breast cancer. We can intervene before symptoms even appear. After that, we enter the clinical phase. The person begins to experience symptoms, seeks care, and receives a diagnosis. This is often when most diseases are first detected, but by then time has passed and options may be more limited. Finally, the disease either resolves, becomes chronic, or leads to death. That's the end point. And that journey, from invisible beginnings to final outcomes, is the natural history of disease. So, where does prognosis come in? Prognosis is our way of answering the question that almost every patient asks: what can I expect? What's going to happen to me? In clinical care, prognosis helps us describe the likely course and outcome of a disease. And in public health, it guides how we plan services, evaluate treatments, and prioritize interventions. But prognosis isn't about crystal balls or guesses. It's grounded in data. Data from studies that follow large groups of patients over time, looking at survival, complications, and recurrence rates. One key measure we use is the case fatality rate, the percentage of people with a specific disease who die from it within a certain period. It helps us understand how severe or lethal a disease is. Another is 5-year survival, especially in cancer care. If we say that a certain cancer has a 5-year survival rate of 80%, we mean that 80 out of 100 patients are alive 5 years after diagnosis. These numbers don't predict an individual's fate, but they give us a framework for decision making. They help patients weigh options, and they help doctors speak honestly, but with perspective. There are also other ways to describe prognosis. Median survival time tells us the time by which half the patients in a group are still alive. Relative survival compares the observed survival of patients with a disease to the expected survival of similar people in the general population. It helps isolate the impact of the disease itself from other risks. We can also talk about disease-specific survival, focusing only on deaths caused by that particular condition, ignoring unrelated causes. This is helpful in older populations where multiple conditions may exist simultaneously. But describing prognosis isn't just about statistics, it's also about timing. Let's go back to that preclinical phase 1 mentioned earlier. This is where screening can change the game. If we know how long a disease stays in this silent phase, we can design screening programs to detect it early, before symptoms begin, and ideally, before it becomes harder to treat. For example, cervical cancer often develops slowly over many years from precancerous changes in the cervix. This long preclinical phase is what makes pap smears and HPV testing so powerful. They allow us to catch and treat abnormalities long before they become life-threatening. Of course, screening isn't always straightforward. Sometimes we detect diseases that never would have progressed or caused harm. This is called overdiagnosis, and it's an important ethical consideration. Because while early detection can save lives, it can also lead to unnecessary anxiety, treatment, or complications. Understanding the natural history of a disease helps us find a balance. It helps us decide when screening makes sense and when it doesn't. Let's talk briefly about prognostic indicators. These are patient characteristics or disease features that help us estimate likely outcomes. For example, tumor size and grade in cancer, viral load and HIV ejection fraction in heart failure, age, comorbidities, and functional status in older adults. These factors allow us to personalize prognosis, to move from population-level averages to more tailored expectations for the individual in front of us. So, what comes next? In many ways, understanding the natural history of disease is about planning ahead. It's about knowing when to act, how to act, and what outcomes are likely if we do or don't. It's the foundation for evidence-based screening, for realistic patient conversations, and for prioritizing resources in public health. It reminds us that every disease follows a path. Our job as epidemiologists, as clinicians, as health advocates, is to understand that path well enough to change its direction when we can. That's all for today's episode of EpiDecoded. I'm Dr. Arora, and I hope this journey into the natural history of disease gave you a clearer sense of how we understand illness, not just at its worst, but from its very beginning. In our next episode, we'll be shifting gears to focus on study design, specifically how observational studies help us uncover the connections between exposures and outcomes in the real world. Until then, stay thoughtful, stay curious, and stay well.